my name is Dr. Sandesara, and I'm an electrophysiologist at Virginia Heart. I specialize in treating patients with heart rhythm disorders. Atrial fibrillation is the most common heart rhythm disorder in the world. It is projected that by the year 2030, 12 million people will have atrial fibrillation in the United States. Atrial fibrillation, also known as AFib, happens when the upper and lower chambers of the heart are not coordinated, causing the heart to beat irregularly. It may beat too slow or too quick, which greatly impacts the amount of blood flow that is pumped from the heart to the body. The risk for AFib increases as you age. Other common risk factors include high blood pressure, obesity, sleep apnea, diabetes, heart failure, smoking, and alcohol consumption. Symptoms include shortness of breath, fatigue, chest discomfort, or dizziness. Anyone experiencing these symptoms should talk to their doctor. If left untreated, AFib can lead to heart failure, and it may even cause a stroke. Oftentimes, people are unaware they are in AFib and is diagnosed in the doctor's office during a physical exam. Other times, people seek medical care due to the onset of new symptoms. To make a diagnosis, the first step is to evaluate the heart rhythm through an electrocardiogram. In some cases, we will also utilize a remote monitoring device to analyze the heart rhythm over a period of time during normal activities. Now, let's talk about the treatment options for AFib. Treatment requires a comprehensive four-pronged approach. This includes risk factor modification, controlling the heart rate, controlling the heart rhythm, and preventing blood clots that could lead to a stroke. For patients for risk factor modification, we evaluate their lifestyle and medical risks. We spend a great deal of time on how to best address them. Lifestyle changes have a major impact on the treatment of AFib. Weight management, for example, is extremely important in the treatment of AFib. When a patient's overweight, atrial fibrillation may recur despite maximum medical or interventional therapy. We ask patients to engage in a cardiovascular fitness program and pursue a heart-healthy diet. Any alcohol can cause atrial fibrillation, which is why the goal is complete abstinence to prevent recurrence. There are several methods available to control the heart rate and rhythm. Medications can control the heart rate, and other more specific options called antiarrhythmic drugs can be administered to help maintain normal rhythm. Either choice may improve your quality of life, but they all have side effects, limiting their effect. If the patient cannot be treated with medications alone, then we would consider a cardioversion for events that were symptomatic and persistent. This procedure involves giving the heart a controlled impulsive energy to the chest to restore normal rhythm. A pacemaker is recommended for patients who are in AFib with a slow heart rate. We have found that the most effective therapy is catheter ablation, as this is the best long-term success in maintaining normal rhythm without the need for medications. This procedure guides a catheter or wire into your heart to destroy small areas of tissue that may be causing the abnormal heartbeat. With any treatment, there is a small but possible chance atrial fibrillation may still recur in the near or distant future. Therefore, patients require follow-up with their cardiologist or electrophysiologist on a routine basis to monitor their condition. Some patients may not require treatment for atrial fibrillation, especially if their quality of life is good, and they do not have significant symptoms, and they can maintain a normal, active lifestyle. For these patients, we help control their heart rate only and employ medications to prevent a stroke. Although there is no cure for atrial fibrillation, there are ample options for management, and many patients can achieve a great quality of life when they seek ongoing treatment and care. Atrial fibrillation should never interfere with a person's ability to be active or to maintain a normal quality of life. If it does, you should discuss this with your cardiologist to review treatment options. At Virginia Heart, we perform over 700 ablation and heart rhythm procedures every year. We're also involved in research studying technologies and medication options to provide our patients the most cutting-edge therapy options for atrial fibrillation. Thanks for watching. I'm Dr. Chirag Sandesara with Virginia Heart's Heart Rhythm Center.